Good morning. My name is Stephanie Nolting. I'm a physical therapist at PT Connections in Pueblo, Colorado. And I want to make sure that people are breathing right, which sounds pretty goofy considering that, well, if you're walking around, you're breathing okay because you're alive. But a lot of patients that I meet actually are breathing backwards, meaning that their diaphragm is not very effective for letting the air in. So our diaphragm sits underneath our lungs and it's like an upside down bowl. And so when we're breathing shallow, just walking around day to day breathing, it's moving a little bit to help let some air in, but when we do deep breathing, it becomes even more important. So as we take a deep breath in, that muscle should actually flatten out. And if that muscle flattens out, then belly muscles, back muscles, even pelvic floor muscles, they should all expand and kind of get out of the way for that pressure that's coming down. So a lot of people don't know what muscles are responsible for breathing, so they think, well, what about these muscles up here? Shouldn't they be moving? And if you're looking for someone that's breathing, you're looking for their chest to rise and fall, right? And all of that is true. But the chest rises and falls because of the air going in. The diaphragm that almost creates a little suction as it flattens to pull air from the atmosphere into the lungs, so then the lungs can use that exchange and put the oxygen in our blood cells for the rest of the body. But we should not be using our chest muscles to lift our rib cage to let air in. Now there's a lot of people with lung conditions that'll actually do that as a compensation, and you'll see them chest breathing quite a bit. Ideally, we use our diaphragm. So if you took a big deep breath in, your belly muscles should expand, and not because you're pushing them out with the muscles of your belly, but because they're able to expand out of the way as you breathe in. So if you are someone who's practicing this, and I hear this a lot, and you go, oh, I breathe in and I suck in when I breathe in, then that means they're compensating with other muscles. And you should practice in a quiet setting so there's not a lot of distractions or other things going on, belly breathing or diaphragmatic breathing. Breathing in deeply, letting your stomach expand, and when you exhale, the stomach relaxes, and so does the diaphragm. Then you can also concentrate on back muscles. So putting a hand from front to back, both areas should expand. Now the back muscles do not move near as much as our belly muscles, just because there's less allowance of movement because the muscles aren't as long and flexible in the back as they are in the front. But you should be able to feel it with your hand when you breathe. So if that is something that doesn't come natural to you, then practice several times a day, and when it does become natural, then you won't have to practice it more. People who sing or play wind instruments or do yoga or meditation, things that incorporate breathing, they tend to be naturals at this because it's already well practiced. So those things you can kind of take over as your long-term practice once you've mastered it. Good luck, and if you have any questions, give us a call at PT Connections, 719-565-6678.